Welcome to the captivating landscapes and vibrant cultures of Papua New Guinea, a nation that faces unique health challenges amidst its breathtaking beauty. This documentary delves in the heart of Papua New Guinea, unveiling the impact of COVID-19 and shedding light on the journey towards better health. Meet Miriam, a retired nurse with a remarkable journey that began in Lae. At just 10 years old, Miriam took on the responsibility of caring for her siblings when their parents were sent away for 2 years for TB treatment.
Both of them were split. One was in Finchafen, TB clinic, and one was in Lae, Malahang clinic. They were undergoing 2 years of TB treatment.
A dedicated nurse at Port Moresby General Hospital, Sister Bessie, underscores the significant impact of tuberculosis in the workplace, urging for the implementation of infection control measures.
It takes parents away from their families. It takes mothers away from their children. So vaccination against TB is very important. And what I observe at work too, it's almost every shift we have 3, the minimum would be 3 and the most would be 5 patients with TB on a shift. And there are 3 shifts, so you would look at probably 15 patients admitted with TB in one day, which is quite a high number.
As a senior pediatric officer, Dr. Hegi emphasizes the dangers of parents avoiding childhood vaccinations, highlighting one serious consequence: brain tuberculosis. Without the protection of vaccines, children face the heightened risk of severe infections.
Childhood vaccinations are to prevent significant childhood diseases such as meningococcal disease, severe pneumonias, measles, pertussis, and TB, serious TB, brain TB that can cause serious complications. So there's about, in our country, our protocol, we give vaccines at 1 month, 2 months. At birth, 1 month, 2 months, and 6 months, 9 months, and we give a booster. When parents avoid vaccinations for whatever reason, they may financial or they're not aware or they're just ignorant, it puts the child at susceptible to catching diseases that are quite serious, and often these diseases are fatal. Like for instance, if you get serious meningitis, which can be prevented by simple injection, pneumococcus injection or Haemophilus influenza injection. These diseases can cause both severe pneumonia and meningitis, infections in the brain. So when they don't have this and we get the kids, we see them getting very, very sick, and they often die. We lose the kids, or if we manage to save these children, they have complications, like they get cerebral palsy, or they're paralyzed, or they can't feed on their own, or they are neurologically affected. So it's important for parents to get their children vaccinated. And right now, vaccination coverage in the country is 60% herd immunity among children, 60 to 70, less than 60%. The cost of treating one child is very high. And once we have vaccinations and we can prevent these diseases like measles, pertussis, and polio, we don't get children becoming like burdensome adults, because children grow into adults, and we want our kids to grow into productive adults and look after themselves, not be a burden and become diseased and often die quadriplegic or with neurological issues or learning deficiency. So I'd encourage parents to bring their children to vaccinations, and childhood vaccinations and immunizations have been ongoing for since we found BCG 40-50 years, and they have been proven and studied scientifically to prevent a lot of serious illnesses.
From Port Moresby Provincial Health Authority, Alexia devises a clever strategy to promote COVID-19 vaccination by leveraging the popularity and renowned actors within the city and country. she orchestrated a compelling drama that captures people's attention. This initiative has demonstrated great success in convincing individuals to prioritize getting vaccinated.
I decided to come up with some script that is more related to COVID itself, just in line with the frequently asked question. So, and then I prepare them on how to act this out, because the drama group that I engaged was, they are kind of popular in the city as well, because of the media and false information that they got on the media and internet, that it scares them, and the hesitancy rate is high. And the aim of this project is get out there to the community, talk to them, make them understand. The beauty of that is we see the crowd coming towards to stand and just listen. While the difference I can see in the drama is when I get the mic and trying to talk, people start leaving the group and going away.
Throughout the drama, misinformation and rumors were encountered in a lifelike and believable manner. The drama relied on engaging and motivating the audience to help them make informed decisions about their vaccination. A non-government organization touching the untouchables are based and have been diligently working in the Highlands region of the country to address vaccine hesitancy. Their main focus has been creating awareness about health issues, particularly regarding the recent COVID-19 pandemic.
We travel through the higher mountains, to the jungles. We walk through the rivers to reach the unreached population in our country, to basically to carry out awareness on bottlenecks and misinformation about COVID-19 vaccine. The messages that we carry out are contextualized to the local knowledge or the local understanding. So in that way, we see we are breaking barriers, and more people are coming forward to get vaccinated. In the health workers training, we have identified that most of the health workers are new to this vaccine, and they lack knowledge on COVID-19, and especially the vaccine side of it. So when we train them and we go out to the community together, and we learn from each other the skills and the technique on how to talk to the people and how to communicate with them. People once again accept us. They come forward to listen to the information that we are trying to relay. While working together, we see that it's not really hostile. Like in the past, communities were being hostile to the health workers. If they do not carry out awareness, and if they go out to the communities with ambulances and the vaccine, it was really scary. Like, people don't want to see those the sign of ambulance and especially the COVID-19 vaccine carriage. So that's where we go in to break the barrier of addressing the rumors and really addressing the misconception. And we are telling them that this vaccine is safe for them to take. And one thing that we have seen is routine immunization. They have mixed routine immunization with COVID-19 vaccine. So when our team go out, the most important thing that we do is awareness. Like, information is very powerful. You cannot just go out there and start vaccinating people. So the most important thing is we do awareness first, and we make aware of them that a routine immunization or the baby suit is different from COVID-19 vaccine. So we break the information down to their understanding. They understand it better. And then the next time the vaccination team comes to do vaccination and routine immunization.